Dynamic physical therapy, this is Connie. How may I help you today? Oh, sure. I would be happy to get you into dynamic physical therapy because of one, the patients that we see, the other employees that are working here, and just the over aspect of the company. Everyone is. Do you want to come in and see Rebecca this afternoon? So you don't
Anytime
have.
you're working with a patient, and it's a very open conversation as far as if you want to work on someone and you need a little bit more feedback. We just
Therapists who are already at the top of the game and want to get that much better. We are so excited every single day to literally take our manuals from classes that we've had, put it on a table.
Like working at Dynamic from a therapy standpoint is that they get to do so much more therapy than they thought possible working at other clinics. A lot of times therapists...
We had you down to see Zach at 11:45.
One of the biggest things I would say is that every day you come into work, you're never going to see somebody do the exact same treatment that you've seen before, and it's always enlightening to see everybody doing different things, and then you as a therapist are inspired to try to learn and do different things.
The adductor group, all the way up to the pubic symphysis, taking our time to just really release that functional tissue restriction. And after we get a nice mobility, myself to be a better physical therapist. After receiving my functional manual therapy certification back in 2008, I really wanted to seek a place that I could practice to the best of my potential. I also really like to teach the therapists that we work with us and train them to be the best therapists they can be.
One of the reasons that the therapists that we hire like working here is because they really get to treat patients the way they want to treat patients. And
Interaction with the patients. I look with it. This company helps the patients. It's where they fix patients, not just come in. The patients are very happy when they leave. They comment about that. We have.
And so, as a mentor, if I'm watching one of my therapists do something that I say, hey, that's really good, but it could be just that much better, it could be ever so much more specific, I get to come in and say, hey, you've got the right spot, except right.
All right. So what we're looking at, I want to see your patterns through your shoulder. These are important because do you feel like
We're all working under the same types of training through the Institute of Physical Art. We have already taken or are taking all the classes that are offered through the Institute of Physical Art. Many of us are working towards or are certified as a functional manual therapist. We're encouraged to
Dynamic physical therapy about a year and a half ago because I wanted the ability to train and teach and also learn.
After trying to improve some of that shoulder stability for you. So what I want you to do is I'm going to put you into a position. So as a resident with the Institute of Physical Art and Dynamic PT, I'm required to take all 7 of the Institute of Physical Art courses, as well as doing training with either...
And everyone is professionally driven to the point of each person contributes something new to our clinic from a manual point of view, and the level of skill involved is above many others.
sound like a pun, but I do think it's a real dynamic place to work. I enjoy the camaraderie between the staff. I like the idea that we're always learning on site. It's something that is really amazing to me is that no matter how long you've been out in PT, working as a physical therapist, there's always still so much to learn. And the faster we learn it, the faster we can get our patients better.
It's a great place to basically get together and learn and share techniques. Also,
at Dynamic Physical Therapy, we do so much more with manual therapy, training our patients to have a different response.